Good day, esteemed viewers, and welcome to Medicine Focus. Medicine Focus, as always, is a channel that brought before you the different classes of medications that are being used in the management of different pathological conditions. Once again, Medicine Focus is here with medications that are being used in the management of a disorder often known as asthma. Under which we are going to look at the different classes of medications that are being used in the management of asthma, their mechanism of action, their examples of drugs or agents under these classes, and some possible side effects, if any. So without much waste of our time, let's quickly look into it. But before we look into the medications, it is very important that we get to know this particular disease condition in question we are discussing here. So let's quickly look into what asthma simply means. The word asthma is originated from Greek word meaning labored breathing, and it was first described for about more than 3,000 years ago. Asthma is a term used to refer to a disorder of the respiratory system that leads to difficulty in breathing. The National United Kingdom guidelines, two United Kingdom guidelines of this asthma, which are the British Thoracic Society and Scottish Intercollegiate Guidelines, as of 2009, define asthma as a chronic inflammatory disorder of the airways which occurs in susceptible individuals. The two main causes of asthma are airway hyperresponsiveness and bronchoconstriction. Airway hyperresponsiveness is the increased tendency of the airway to react to triggers or stimuli that causes an asthma attack. Bronchoconstriction, on the other hand, is narrowing, simply means a narrowing of the airways that causes obstruction in the flow of air. Several factors can lead to asthma, such as allergens being found in the feces of house dust mites, such as pollen grains that comes during June-July season, exposure to some chemicals, some drugs, such as beta blockers and aspirin. Non-selective beta blockers in particular pose a real threat, so should not be administered even in the form of eye drop. Aspirin and related NSAIDs can cause severe bronchoconstriction because aspirin inhibits cyclooxygenase, which converts arachidonic acid, and that arachidonic acid is a bronchodilatory to prostaglandin. So when this pathway is blocked, an alternative reaction occurs, which causes an increase in the production of bronchoconstrictor, which is often known as leukotriene. So basically, there are two types of asthma based on their causes. You have the extrinsic and the intrinsic asthma. Extrinsic asthma is when an allergen such as dust mite that we are talking about is the main cause of asthma here. Dust mite, as I said earlier, and is mostly found in children that are being exposed to rhinovirus. So let's look at the other one, intrinsic asthma. Intrinsic asthma is being caused due to non-allergen or non-allergic factors such as viral infection, irritants which cause epithelial damage and mucosal inflammation, emotional upset, exercise which causes water and heat loss from the airways, triggering mediator release from the mast cell, and forced expiratory volume is the test being carried out in order to determine asthma, and it is being carried out with the help of an instrument often known as spirometer. So let's look at the pathophysiology of asthma. I always like to look at the pathophysiology of disease conditions before dipping into the medications, because by you knowing the pathophysiology of this disease condition, definitely it will give you light on how to tackle this particular disease condition we are talking about. Allergens that trigger asthma, such as dust mites, causes immunoglobulin E production and other non-allergic factors such as viral infection, irritants, which causes epithelial damage, and mucosal inflammation. Exercise, which causes water and heat loss from the airways, triggers mediator release from the mast cell, therefore causing immunoglobulin E mediated reaction from the mast cells, which results in the production or release of mast cell components. And those mast cell components are leukotrienes, histamine, bradykinin, adenosine, and prostaglandin generating factor of anaphylaxis, which results in mucosal edema, accumulation of eosinophils in the airways, production of thick mucus that causes deterioration in lung functions, hypertrophy, and inflammation of bronchial smooth muscles, which leads to further excessive mucus production, airway edema, acute bronchoconstriction. Mucus production normally is a defense mechanism, but in asthma patients, there is an increase in the size of goblet cells, and goblet cells are those cells that are being involved in the production of this mucus. So, as a result of increase in the size of these goblet cells, definitely mucus production, how do I say, will be overproduced. So, we will produce in the quantity more. It will be produced. It will produce more than the required quantity. So it becomes thick as a result, and blocks the airways, which also become blocked with epithelial and inflammatory cell debris. So having now known this, let's quickly look at the main issue, which is the medications that are being used in the management of this disease condition, because this cannot be treated totally due to the causes, which are allergens, factors such as allergies, reaction. So this kind of disease conditions cannot be treated totally, because anytime you come in encounter with factors that trigger such disease condition, definitely you are gonna get contracted by that same disease condition. So treatment of asthma should mainly focus on or directly towards reducing inflammation and increasing bronchodilation, since it involves inflammation and bronchoconstriction. So the preferred route of administration of agents used in the management of asthma is the inhalation route, because this route allows the drugs to be delivered directly to the airways in smaller doses and with fewer side effects than systemic route. We have two terms that are being used to describe anti-asthmatic medication, which are the reliever and controllers or preventers. Reliever is used to describe agents that give immediate relief of symptoms, whereas controllers or preventers is a term used to describe agents that act to reduce inflammation or give long-term bronchodilation. We have inhaled bronchodilators, which have a faster onset of action when inhaled and give better protection from bronchoconstriction. Now, reliever medication, we have the beta adrenoceptor agonist bronchodilators. And inhaled beta 2 agonist is the first line agent in the management of asthma. It produces the symptomatic relief of breathlessness and wheezing. That's how it works. Examples of this medication are the salbutamol, trabutaline, salmeterol, formoterol, ipratropium, and many other medications under this class. There are some more examples of medication under this class. Possible side effect is when used in higher doses results in tachycardia because of cardiovascular stimulation by beta 2 receptors, because there are beta receptors not only in the lungs but that of the heart. We also have inhaled anticholinergic agents. These agents work by blocking muscarinic receptors, so meaning muscarinic 1, M1, M2, M3 in the bronchial smooth muscles. And one good example of this class is ipratropium. Now, the preventer or controller medications. One, we have the anti-inflammatory agents, which are the corticosteroids inhaled. These corticosteroids suppress the chronic airway inflammation associated with asthma. Inhaled corticosteroids are the initial drugs of choice. Examples of these inhaled corticosteroids are the beclomethasone, budesonide, hydrocortisone, etc., etc. And one prominent side effect is when used in higher doses, candidiasis can occur. We also have the leukotriene receptor antagonist, that is for the systemic. These medications inhibit the production of leukotrienes at the leukotriene receptor. Remember, in the pathophysiology, we said leukotrienes, histamines are the mast cells components being produced by mast cell, which causes inflammation, bronchodilators, bronchoconstriction, among others. So examples of this medication have the montelukast, have the staphylococcus. Another medication is the anti-immunoglobulin E, since we said in the pathophysiology that it's as a result of immunoglobulin E mediated reaction. So these are antibodies that fought against this immunoglobulin E. Example is the omalizumab. So that's that from medicine focus. As of now, medications are unlimited. I can know 1001 medication can happen, that I happen to know about 1001 medications, and on the other hand, there will be over 1001 medications that I won't happen to know used in the management of same disease condition. But nevertheless, if there are more updates, more medications being discovered on this asthma, medicine focus won't hesitate to bring it before you guys. So what do you think? What's your reaction? Drop your comments in the comment section, and don't forget to subscribe so that you can get more of lectures like this from Medicine Focus. Good day.